Oh, fantastic. Good afternoon.
Good afternoon.
How are you?
Good afternoon from Lagos.
Thank you for joining us from sunny Lagos, I guess.
It's not only Lagos, so it's like London and Liverpool and Manchester, Lagos now.
Are you
Raining.
serious? What's up? Is it raining? Is it what exactly is going on with the weather there?
I mean, obviously it's rainy season, so it's raining quite heavily.
Oh wow.
But we don't mind. It makes the weather a bit more chilled, unlike the heavy sun that we always experience.
Okay, all right. No, that's not too bad. It's just like we know that when it rains in Lagos, then it disrupts a lot of things.
Yeah, it does. I think once it rains, traffic is gone. So, but when rain is good.
Great. So thank you for joining us, Dr. Olajuwon Alabi. It's such a pleasure to have you here. I know you're a busy man, but I'm grateful that you'll be able to fit us in to come and share and talk about this very important topic. So I know this is your first time on Hangout Cafe. I know you've done numerous Instagram Live, but this is your first time of coming on Hangout Cafe, and we are delighted to have you.
Okay, thank you.
This is a community that is just, we are chilled. We love to encourage people. We love to inform and educate. So that's one of the reasons why we have you here with us. So thank you so much for agreeing to do this.
Thank you.
We appreciate it.
Can you hear me clearly?
Yes, I can hear. Sometimes it breaks up, but I can hear you.
Oh, okay.
Yeah. And folks, can you hear him clearly? Just let us know if you can hear him clearly. I can. Just let us know if you can hear him clearly. Okay, so our guest for today is Dr. Olajuwon Alabi, who is the CEO and Medical Director of South Shore Women's and Children's Hospital in Lagos. He's a specialist obstetrician and gynecologist and a member of the Royal College of Obstetricians and Gynecologists in the UK. He's an expert in advanced gynecology, gynecological endoscopic surgery. I hope I pronounced that well. And he's one of the leading experts in his field in Nigeria. His areas of interest are fibroid treatment, infertility, and assisted reproductive techniques, and so on. And there's loads more that you do. And I think you're also the CEO and consultant at Bloom Fertility Clinic.
Yeah, so that's our IVF branch.
Right. Okay. So, yes, today the topic is fibroids and fertility. Now, fibroid is something that a lot, and loads of women, they have. And how long have you been in this field?
Wow. So I think I started in 1997.
Okay.
Yeah.
That's like, let me see now.
Job
That's
was
20, 25, 26 years.
26 years.
26 years. Okay, so you've been doing it for a long time.
Yeah.
Okay, that's great. And oh yes, again, I need to give a shout out to Dr. Benga Saka, because he was the one that linked us up. And Dr. Saka is one of our resident doctors. Whenever we have anything medical, we bring him on, and one or two other doctors. So, Dr. Benga, there are lots of questions. People are sending lots of questions, but I'm sure you'll try to help us answer the question. So, what exactly is fibroid? What's fibroid?
That's a very interesting question, because I think the easy way to describe it is a growth.
Okay.
When you say I'm sure, I hope you're not hearing any noise. I think my dog has decided to start making noise at this moment. So I can't hear it.
I can hear something scratching. Yeah. I don't know if it's the dog.
Whether I'll continue, but if it's getting too much, then I'll have to sort him out. I hope you don't mind.
No, that's fine. It's not bad.
Okay. So fibroids are tumor, which are like growth. that can be present in different part of the body, particularly the womb. Sometimes you can find it in the breast as well.
Oh, really?
And in other areas as well. But it's not cancerous.
Okay.
It's not cancerous. It's a we don't know why in some people it start growing. We still it's very difficult to know what brings it on or what switches it on.
Right.
We know that it's quite common in Black people. It's hereditary in some cases. It presents very differently in different people. Some people, they have one fibroid. Some people have hundreds.
Wow.
So I think we're still trying to find out a lot more about it. I think for the moment, I don't think we know more than that. Now, there's been a lot of issue about, okay, what causes it?
Yeah.
We don't know. We think there's something in the gene of Black people that causes it. We also maybe, I mean, this is personal, it's not proven yet, think that it might be related to some kind of food as well.
Okay.
So, but that's not proven. Don't quote me anywhere. So, but you know, I think if you look at Black people, that we have a particular type of food we eat.
Yes.
And I think that especially maybe the carbohydrate, the starchy food and stuff like that. Or, you know, so we feel that there might be some association with food, but like I said, that's not proven.
So no research has been done into it, or it's ongoing?
It's ongoing. Research fibroid has been around for ages. There's been a lot of research. I think you just know head through. Most recent one was a research carried out in America, and a few years ago, and they said they discovered the gene, you know, gene for fibroids, meaning that you can do like a gene typing and know if you're predisposed to fibroid or not.
Oh, I see.
But in terms of any other research, I mean, there's still a lot of research going on about, okay, so you have fibroid, what do we do about it? How do we stop it? How do we make it bigger and stuff like that? But we're still waiting. Like I tell people that I wish I can find that research that tells you that, right, switch this off and you don't have fibroid. I think I'll be a very, very rich person, really, if I find that. But we haven't found it yet.
Wow. Okay. It's interesting that you said it's found it. You can also have it in the breast and other areas. I never knew that. I thought it was just in the womb.
No.
Wow.
You can find it. So the one in the breast is called fibroma.
Fibroma.
You find a lot of young women having breast lump. It's most likely a fibroma, which is almost the same kind of tissue or constitution. It has almost the same kind of background like fibroid.
Right. Yep. Okay. Interesting. So how do people discover that they have fibroid? What are the common symptoms? What are the things to look out for?
A lot of people don't know they have fibroid first because they have no symptoms.
Oh, wow. Okay.
So majority of people are symptomless. That means they don't know.
Right.
And that's why sometimes it grows out of proportion before people discover it.
Right.
The symptoms can be, it's very common in the young age group or the reproductive age group, which is, I noticed that my period is quite heavy or getting heavier. Right. I used to have my period every 2-3 days, but now it's 5 days. I used to have, I used to use like 2 parts a day, but now I use 5 parts. Right. So those are suggestive. Okay. Then it might make sense to now in UK you want to maybe get in contact with your GP. Okay. But in Nigeria, everybody have access to a scan center where they can go and have scans. Okay. So you also have people that are trying to conceive. You have couples that maybe have been trying to conceive for a few months or a few years and say, why is it not happening? And they go for scan and then you pick it up. Or some people, this is the funny part. Some people feel that they are gaining weight. Okay. They just feel that, okay, why is my dress not, why am I not able to enter my dress again and stuff like that? Yes. And some people are told that, friend, are you pregnant? Oh, sorry. I said that to someone. I was so embarrassed. And then the person turns to you and says, no, I'm not pregnant. You know, so it comes with a bulge as well. So some people have like bulge
Wow.
in their tummy, and makes, you know, a few years ago, I'm sure you've heard a lot of story that, oh, that woman, she was pregnant for 4 months or 4 years.
Yes.
Yeah,
Yes.
some of them are fibroids.
Oh, I
Yeah.
see. Do you know, the day I said it to someone, I said, "Oh, are you pregnant?" And she said, no. I was so embarrassed because the tummy looked like she was actually,
Yeah.
wow.
So
Gosh, okay.
those are the main things. There are other ones like going to the bathroom all the time to wee because it's pressing on your bladder.
Okay.
Constipation. Sometimes,
Constipation.
yeah, sometimes people have blood clots, something called DVT, because it's compressing their blood supply. It's not letting blood come from their legs upwards, so they have blood clots.
Okay.
Yeah, so those are the main ones, really.
Okay. I know you said that we don't really know why. Can you hear me clearly?
Yes.
Okay. You said we don't know what causes fibroids, but are there any risk factor that may increase the likelihood of having fibroids?
Yeah, being black, a black woman.
So, but white people do
Yeah,
have it too sometimes.
white people have it, but not as high as a black person.
Okay.
Uh, Asians have it as well.
Okay.
So when I say black, it doesn't limit to black Africans alone.
Right.
It limits to, it goes across the Caribbeans as well.
Okay.
So I think there's something, I mean, we're still kind of thinking why, because, I mean, for example, if you look at sickle cell.
Yeah.
So you can argue that, or the theory is that people have sickle, you know, the AS developed that to prevent malaria. That's, you know, malaria endemic area.
Yeah.
People, your blood kind of changes to protect you from malaria.
Yeah.
But the question is that why is fibroid so common in black people? And we haven't been able to actually find that. But you know, I think one of the problem as well is that because it is common in black people,
Yeah.
and not as common, I mean, not as common in white people.
Mm-hmm.
Maybe that's why the research on it is not as. I mean, for example, if you look at endometriosis, which is almost like a cousin of fibroid,
Yes.
you know, the research on that is, I mean, it was discussed in the House of Parliament in England recently. So I think that unfortunately, in this part of the world, we don't lay so much emphasis on research and development. But those are the things that we really need to do. What causes it? What triggers it? How can we stop the trigger? You know, stuff like that.
Yeah. Well, you know, it's interesting that you said that in this part of the world, as in Nigeria, Africa, and maybe some Asian countries, a lot of research has not been done. But we know that a lot of our doctors, good doctors like you, we have them all over the world. So why are they not championing this research? Why are they not?
Yeah, but you know that research has to be funded.
Okay, so the funding issue.
The person funding will first look at why do I need to fund this? So if there's no advantage to them to fund it to their local community, I think, to be honest, research on fibroids should be driven from probably Africa, because you know it's something that is almost at pandemic level.
Yeah.
You know, so, and as you know, there's a lot of things that have not been done properly in this part of the world.
Yes.
So maybe that's why we're not getting the results we want. So it would have made sense if the teaching hospitals in Africa are leading the research on fibroids.
Absolutely, yes. Absolutely. Wow. Okay. So if you have all these symptoms, so the going frequently to the bathroom, maybe heavy period pain and discharge and all of that. So when you go to the doctor, what are the tests that they do?
Okay, so when let's look at somebody book an appointment to see me. The first thing I want to do is obviously ask them about their history. Okay, how long have you noticed this? You know, so I mean, lots of the time, people that come to me already know they have fibroid. They've seen somebody, and they're just coming for a second opinion. So they might have had a scan before, but I scan them again. I get a scan. So the scan allows me to identify what type of fibroid they have, because there are different types of fibroid. And then also kind of see whether I can relate the fibroid to their presentation, which is what they are talking about.
Right.
So the womb is almost like it's a space. It has a space in between, inside it.
Okay.
So fibroid can be attached to the womb from the outside.
Okay.
It can be in the wall of the womb.
Right.
But it can also be in the cavity of the womb, where the baby stays. So those are 3 types of fibroid, and they present differently. Now, unfortunately, some people have all of it together.
Wow.
And some people are lucky to just have one of it. So it's easier to manage that way. Now, unfortunately as well, some people will have fibroid and leave it for like 10 years. So what would happen is that fibroids don't stay. They grow just like anything. You know, anything in our body grows, whether it's bone, brain, they shed new ones, they form new ones.
Yeah.
So same with fibroids. They're not stationary, they keep growing.
Okay.
So if you have a fibroid about 10 years ago, the likelihood that it will be bigger and would have invited his family members to join, the likelihood is a lot higher. So I think getting an opinion on somebody that deals with fibroid all the time is very important. Sometimes people get wrong advice. So you go to a doctor, maybe not a specialist, and the doctor says, oh, don't worry about it, go and try to get pregnant. Which in itself, it's not a bad idea, it's not a bad advice. But the only thing is that when you tell somebody that, you have to tell them that, come back and see me in 6 months or 1 year.
Okay.
So that I can monitor your progress.
So, sorry to interrupt you, but when you say to a woman, go and get pregnant, does that mean that getting pregnant will prevent the fibroid? Well, it's not, is it?
That's no, it doesn't prevent it. It doesn't prevent it. But what happened is that, honestly, I feel that sometimes, if you know you have fibroid well, let's say you're 25.
Yes.
And you have a small fibroid, and you're in a relationship and you get married.
Okay.
It kind of shows that when you have a child, the rate at which it grows is different from when you haven't had a child. So pregnancy it doesn't prevent it.
Okay.
But I think it slows it down a bit.
Ah, okay. Okay. But I also, when people are pregnant, if I remember, because I remember a friend of mine, when she was pregnant, she had a lot of pain because of the fibroids surrounding the womb.
Yeah. Okay, so now part of the symptoms when we're talking about how does fibroid affect you, in pregnant women, fibroid actually causes a lot of pain. We get a lot of people admitted in pregnancy because of fibroid. Yeah. So basically, when you are pregnant, the blood supply to every part of your womb increases.
Okay.
Including the fibroid. So the fibroid gets a lot of blood inside it.
Okay.
And then suddenly, so it's almost like a drainage. Blood goes in, it comes out.
Yes.
For some reason in pregnant women, that drainage, the blood going out, it blocks. So the fibroid gets engorged with a lot of blood, and then it becomes painful. So it's called red degeneration.
Red degeneration.
So, and all you need to do really is admit the patient, give a lot of painkillers, and then in 2 or 3 days, it settles down and she continues.
Okay.
Yeah, but I've seen a lot of people go through that, and before they get pregnant the next time, they come and say, doctor, no, I don't want to go through that again. Remove this fibroid before I get pregnant again. Which sometimes makes sense, because if somebody is being admitted with pain for about 3 or 4 times in a pregnancy, it's most likely going to happen again.
Yeah.
So it might make sense to say, get it out.
I've seen some comments, people saying they have all 3 that you described, different types of fibroid. My goodness.
Yeah.
Okay, so they come to see you. You've let them know they have fibroid.
If I'm not completely happy with the scan, I can't see, because sometimes, you'll see people that they're almost 9 months pregnant with fibroid, and scan cannot see that totally. So you have another imaging called MRI.
Okay, yeah.
MRI is that one that you go in, if you watch a lot of medical program, is that one, that big thing that people go in and stay inside it for a few minutes.
Yeah.
That is more representative. It gives a lot. I use that almost routinely because it allows you to pick all fibroids.
Okay.
So for us, there's something called fibroid mapping. So if you come to me now and I want to, let's say, I think you need surgery.
Yeah.
I want to make sure that I know where all the fibroids are, because I don't want to go in and miss one fibroid.
Okay.
And we get a lot of that. We get a lot of people that have gone somewhere, they've done a lot of, they've done surgery, and they come back and say, doctor, I think I still have fibroid, within like 6 months of them having surgeries. So meaning that they didn't, and it's a very easy mistake to make if you don't map it, because all the structures are swollen when you're doing the surgery.
Yeah.
So you have to have a conscious idea that, well, I'm looking for that.
Okay.
So you have
but is it possible to remove every single fibroid in a woman?
One of the things we get from people in your end and people from abroad is that, oh, doctor, when they were removing my fibroid, one of the doctors said they should not remove all because it's a bit dangerous. We don't see that. We don't see that at all. We remove all.
Okay, that's interesting. I would love to talk to a UK doctor to find out why.
So I think now I must tell you that recently we've gotten a lot of UK residents coming to Nigeria to do fibroid surgery. A lot.
Really?
Yeah, I think that is stemmed from two things. I think one, people are starting to understand that Nigerian doctors based in Nigeria, probably are more experienced in treating fibroid than the UK doctors.
Yeah.
Because something, I mean, yes, there's the worry about the healthcare, is it safe? But I think in terms of the experience, the gynecologists in Nigeria are way more experienced in treating fibroid compared to the UK. I mean, so let me give you an example. So I did all my postgraduate training in the UK.
Yeah.
And I can tell you for 10 years, maybe I saw 5 fibroids. Now, but that depends on which part of the UK you are. Obviously, if you are in Lewisham, Kings, where there are a lot of black community, it's probably going to be similar to Lagos.
Yes.
But if you're in Lincoln, Bradford, Manchester, stuff like that. So I think the experience here is a lot. So I didn't see, maybe I saw about 6 or 7 fibroid in 10 years.
Okay.
The year that I came to Nigeria, I probably saw like 100. I probably treated like 100.
Wow.
So it's a different ballgame.
Okay.
So having said that, I believe that that's the reason it's easier for me to say that I can remove all compared to somebody that don't do that.
Okay. Oh, okay. Gosh, I can see that people are putting questions. Please put the question in the question box. It's easier for me to pick it up than you put it in the comment. So put your questions. If you've got any questions for Dr. Olajuwon, please put it in the question box. That way I'll be able to, he'll answer your questions later on.
Yeah, so going back to the investigation as well.
Yes.
Obviously, if somebody is bleeding, I want to make sure that we check their blood level. You'll be amazed that a lot of people with fibroid are going with, they're going around with half their blood volume or blood level.
Okay.
So for example, a normal blood level should be about 11.5, 12, their hemoglobin.
Yeah.
I see a lot of people in clinic because they've bled. So the problem is that, okay, so if I have a period, I bleed. Before my next period, my body makes it up because it's not heavy.
Yes.
But in these people, they constantly every month have heavy periods. So their body is not able to make it up. So they have almost like a chronic anemia. They have become almost resistant to that low level.
Yeah.
But they're walking around with almost like 7 instead of like 11.5. And we've seen recently there's a lady that came to us and her blood level was 3.
3.
Yeah.
Wow.
So we had to urgently transfuse her with about 4 units of blood because, you know, that can cause a heart attack as well, or heart failure. Yeah.
Wow. Oh my goodness. Okay. So what are the potential risks for the treatment? Now, also, when people come to see you, it's not every patient that you say we have to remove the fibroids. Some you watch it, I guess, for a few months, yeah?
Yeah, so when you come and see me, so the first thing is that I want to identify what type of fibroids you have.
Yes.
And how it affects the period or the symptoms you've presented with.
Okay.
You're absolutely right. Remember I said that some people maybe some people just did a routine annual test.
Okay.
And they found that they have fibroid and it's not disturbing them anyway.
Okay.
And it's not a fibroid that, and maybe they're not married, it's not going to disturb them. People like that, you can reassure them and say, you know what, I think we can keep an eye on this.
Okay.
Come back and see me in 6 months or 1 year. Or you can, you know, you can speak with people and say, okay, I think you have a 6 centimeter fibroid. I don't think it's disturbing you, but I think it will be easier to remove it now than leave it when it becomes like 13 centimeters.
Okay.
And it also changed the kind of treatment possibilities that we can give you.
Okay.
Because in some people, you can do keyhole surgery to remove fibroid. You don't need to cut them, you know. You can remove it easily and they go home the same day or the next day.
Yes.
Leaving it to get, once it gets bigger, then that option is taken away.
Okay.
So let me come back again. So once you see somebody and then you've decided, so you need to decide whether they need treatment or they don't need treatment. Do they need, for example, if your fibroid is not big, you're not married, and it's just causing heavy periods, you can manage the heavy periods. You use some medicine, some are non-hormonal, some are hormonal, you know, and sometimes it might be that even the person needs surgery, but they're not ready for the surgery right then because maybe they are reading for their master's, they're doing a master's exam, they're doing that. So you want to manage the symptoms. Okay. So whether it's pain, whether it's bleeding, you want to manage that. Okay.
Yes.
A few years ago, there was a drug that was being peddled in England. It's called S13.
S13. Okay.
So it's a drug that shrinks fibroid.
Oh.
And it's meant to shrink it permanently.
Right.
So about 8 years ago, everybody started using it. It's almost like a wonder drug. Yes, you don't need, you know, especially, you know, UK doctors are, you know, the evidence says this and that, and they start using it. And then about 2 or 3 years later, they started finding out that women that were on it were having liver failure.
Oh, wow.
So obviously, they had to pull it out of the system.
Wow.
So the reason I brought that on is that there's no drug that treats fibroid.
Okay.
There are temporary drugs that you can use to reduce the size of it before surgery. Okay. But you cannot use it as a long term for it.
Yes.
So the problem is that once you use it, there's an injection called Zoladex in the UK. Some people call it Prostab. It shrinks, it mops the hormone that supply fibroid, that feeds fibroid.
Okay.
But once you stop the medication, the fibroids grow bigger. So you can only use it. You're only advised to use it if you are about to have surgery, just to reduce the size and make it easier for the surgeon to remove. Right. So that's medical, you know. Now that takes us to other options. Now, the one that's been tested over the years is surgery. You know, surgery has been around for hundreds of years. Yes. The traditional one is called open surgery. And open surgery is the most commonly done fibroid surgery. Even in Nigeria, it's the commonly done because the fibroids are big and you need a big hole to remove it. Mm-hmm. So the incision can be like the bikini type, like CS. Yes. But for people that have extensively large fibroid, you might need to do like an up and down. Okay. So it gives you a lot more access. Most recently, there are keyhole surgery, something called hysteroscopy, where you put a camera inside the womb a camera goes in from the vagina inside the womb.
Yeah.
And then you can use it to remove the fibroid inside the womb. That's a fibroid called submucosal fibroid. And those are the ones that affect fertility and cause heavy flow.
Right.
Now that takes 20 minutes to remove. We do quite a lot of that. And the patient goes home the same day.
Okay.
All right. So there's another one called laparoscopy, which is camera from outside.
Yeah.
And you use it to remove some type of fibroid as well. And most recently, there's also something called the robotic surgery, where you use robots to remove fibroids. That is, it's coming up in the UK now. I think it's more established in the US, but I think it's coming up in the UK. It's not routinely available, but I'm sure it's coming up. Maybe I
do that. Do you do that?
Sorry?
But you don't use that.
Oh, no, we don't. The robot is too expensive for us to buy. But I think that we're looking at it.
Okay. Okay,
so that is surgery. Now, surgery is, for me, surgery is the gold standard.
Okay.
Because as long as the person knows what they're doing, the surgeon knows what they're doing, because surgery has advantages, but it also has disadvantages. The disadvantage is that it's a surgery and you're going to be put under anesthesia. So there's anesthetic risk. Contrary to what people think, I mean, in my facility, we've done like over 2,000 surgeries and, it's safe. Now, you can do surgery awake using, something like epidural or spinal, or you can do it asleep. It's very common for surgeries to be done as awake in Nigeria, unlike in the UK where it's more asleep. So that's the other risk for surgery is obviously the bleeding during surgery, and then the risk of injury to organs surrounding the womb, like the bowel or the bladder. Or infections. I think there's this thing about fibroid and surgery in Nigeria. Almost everybody believes that fibroid is extremely dangerous, and that stems from. Let me give you an example. So, surgery is risky, without any doubt.
Surgery is risky. I get.
And it doesn't matter where you are in the world. Surgery is risky. Contrary to what. So, unfortunately, people hear, because it's, people hear things very quickly in Nigeria. For example, if somebody died of a CS in Nigeria, you're likely to hear it in England. But if somebody dies from CS in England, you won't hear it. Because that information doesn't go into public like that. But it does happen. So my take on it is that with the amount of surgery done in Nigeria, fibroid surgery is relatively safe. But I have to put a caveat to that. You have to go to somebody who's well trained, and it has to be a good hospital. So that's the caveat. Now, I think a lot of people will now ask me that in Nigeria, how do you determine good hospitals? So, but that's a discussion for another day, really. So that's a discussion for another day. So now, recently as well, there have been new technology formed or that can treat fibroids without surgery. So about 30, 40 years ago, there was an application of something called embolization, fibroid embolization. And that is very commonly used in the UK. So
what's that?
That is done by somebody called an interventional radiologist. So I, as a gynecologist, I see the person, I give them the option, and they say, oh, doctor, thank you very much. I don't want surgery. I want non-surgical means. So I refer them to a colleague of mine called an interventional radiologist, who then identify the blood supplies to the fibroid with X-ray thing, and then shut the blood supply off. And that's it. So over the next couple of months, because the blood supply to the fibroid have been shut down, the fibroid reduced, sometimes disappears. My worry sometimes with that is that I am a bit careful not to introduce that to somebody who has not had children. I'm a bit careful with that. Although there's some research that shows that it's not dangerous, But I am a bit careful because
Yeah.
of that, because I've seen a few times when that has been done, and then I've seen something happen that. So I will probably not offer it to somebody that has not gotten pregnant before and want to. But having said that, I've also seen people that had it and have children.
Okay.
I'm just saying that I'm a bit reluctant in offering that to somebody
who has not.
Who has none. I think that's just my personal opinion.
Okay.
Now, most recently as well, there's another one called HIFU, which is high intensity focused ultrasound. This is done a lot in the Asian countries like China and stuff like that. It's also coming to the UK because I read about 2 centers in the UK piloting it at the moment. So it's an ultrasound, but it radiates heat. And the heat is focused on the fibroid.
Okay.
So it's almost like microwaving the fibroid off or killing it off.
That can be safe, can it?
Well, it's not be safe because it localizes the heat on the fibroid.
Okay.
So the people that I've not seen it done before. I've read about it. I've seen it. I think that I would like to. There's a guy offering it in Nigeria at the moment, but my personal opinion is that I think it should have been tested. It should have been researched and see whether it works in our population or adapting it here.
Yes.
But you know, as things work in Nigeria, people can bring anything and start using it, and it's fine.
Yeah.
But according to the Asian data, it's meant to be safe. So I think that's what so it's called HIFU.
HIFU. Okay.
And there's so many other new techniques as well. The main thing is for somebody who knows what they're doing to help the person go through the journey of saying, what type of fibroid do you have? What is the safest and the easiest way to remove this? Okay. The person that's treating you, how skilled are they?
Good. Yes.
What are the complications that can happen? And have you processed it? Are you happy to go through the procedure knowing that this can happen?
Yes. Yeah.
What are the plan of the person doing it to reduce the chances of those complications happening? And what is the track record of this person doing that? So those are the things that you need to try to find out. Like I said before, I think it's amazing how many people, this year alone, it's amazing how many people have come from Canada and England to do surgery in our center. And this is because of the waiting list from the NHS. I'm sure you know that it's a very friendly place at the moment. Equally, the Canadian system is almost similar to the UK system as well, where, you know, people wait, it's non-pay, you know, it's almost not paying service as well. So people are waiting for like 18 to 24 months for a fibroid surgery. I think sometimes they feel that, you know what, I'll just go back to Nigeria and I'll do it quite easily and stuff like that. Yeah. So that's where we are now.
Okay. Dr. Saka is on. He wants to come on. But before I do that, I'm just going to ask, so how does all of this affect fertility and getting pregnant?
Okay. So very good question. A lot of fibroids do not affect fertility. Sorry, I'm going to do something so that I'm sorry I can't share anything, but I'm going to draw a diagram. All right. I'll see whether people can see this. Can you see that?
Yes.
So this is the womb, okay? So you can have a fibroid here. Can you see it?
Yes.
So a fibroid here is outside the womb.
Okay.
So the baby stays here.
Okay.
So this fibroid cannot affect fertility.
Okay, the one outside cannot. Okay. But you said there's some that are in the womb.
Right. There's another one here. This one.
Yeah.
So that's a submucosal fibroid. It's almost like sitting where the baby will stay.
Okay.
So if you have this type of fibroid, you have to remove it because it's almost acting like a contraception. I don't know whether you're...
Yes.
Can everybody...
Yes.
This...
Okay.
Okay. So that's the problem. It depends on the type of fibroid you have. It depends on, so that's why it's very important to map the fibroid. All right, so once you map it, once you know the type of fibroid, then it's most likely. Now, the controversial one is this one here. So the one here, this one.
Yeah, okay.
So it's neither out or inside, it's in the wall. So when it's small, it's fine. But how about when it's big?
Yeah, yeah.
So those are the ones that are difficult to determine. So one of the things with fibroid is that you can see two different people with identical fibroids. One gets pregnant easily, the other doesn't. And the moment you remove the fibroid in the other one, she gets pregnant. So we can only advise you based on the information we have. And yeah, there are times in the past that I felt I've advised somebody that you might struggle to get pregnant, and they come back and say, "Hey, doctor," like 2 years later, "Doctor, I'm pregnant." Yeah,
I guess.
But remember that fibroids also causes miscarriages as well.
Oh, really?
Yes, it does. Yeah. So because you're pregnant doesn't mean that you still have to go through that process where you're going to keep the pregnancy. So I've also done a few fibroid surgery on people because they keep having recurrent miscarriages.
Okay.
So it's not only about fertility, it's also about miscarriages as well. So for example, if somebody comes to me and say, "Oh, I've been having recurrent miscarriages," one of the things I want to make sure they don't have is fibroids. Okay. And I want to make sure that it's not in the location that can affect their fertility. Yeah. So fibroids can affect fertility different ways. One is obstruction. Two is that it changes the outlook of the womb and make the journey time sperm a lot longer. But before the sperm gets to where it's meant to fertilize, it's already run like 5 kilometers and then die.
Interesting. I guess from what all the things that you said, I guess women should ask loads of questions before they go in for surgery. And it's not just, "Oh, this person did it for my friend, so I should, ask lots of questions."
You should have, I think you should ask a lot of questions. You should. I think my advice with people is that I know that in Nigeria they don't do a lot of MRI.
Okay. Personally,
I feel that everybody that's having fibroid should have an MRI before they do the fibroid surgery. It's important.
I mean, I'm not a doctor and all of that, but I would think that before you actually agree, say, "I'm going to do surgery on a woman," you should do MRI. Doesn't that make sense?
Some people accept scan, because you remember that Nigeria is a country of limited resources.
Yes.
You and I, or the people that I treat, might not fall in that category. But remember that we're not the only Nigerians. We have different cadres of Nigerians. You have the high, people that can afford things, and even people that cannot afford 2 naira.
Okay.
2,000 naira to eat in a day. You remember?
Sure. Yes.
So they totally depend on the government hospitals.
Okay.
And the government hospitals are very underfunded as well. I can't even know, how many government hospitals have an MRI department until maybe recently. So it's more complex than that. And if you have gone through your training in Nigeria and you've gone through a teaching hospital that don't have MRI, you're likely to not need it when you're treating people. You have adapted what you have to manage, and so some things you will now have to start. For example, if a doctor comes to work for me now, it might be that I might have to start on training him in some aspect and then retraining him in some aspect.
Someone just put that in the UK they don't do MRI also.
Well, most of the people I've seen from the UK, they have MRI. It depends on your size of fibroid as well. So if you have a small fibroid, they might not do MRI. The scan may have captured what they're looking for.
I see.
But if you have a 24 anything above 20 weeks fibroid, I will expect your UK doctor to ask for MRI.
Okay. All right. Welcome, Dr. Saka. Thank you for joining us.
Good afternoon. I don't know if you can hear my audio.
Yeah, we can hear you. We can hear you. So your friend is here. Do you have any questions for him?
Thank you very much, Dr. or Mr. Alabi, depending on which system we'll adopt, whether it's the UK or the Nigerian system, but we should still recognize you as a doctor who is fully trained and qualified and has now become a Mr. all over again.
Well, I want to thank you on 2 grounds. I want to thank you for inviting me to this program, but I also want to thank you for Bukayo Saka. Don't blow your name away from Arsenal. Thank you very much.
Thank you. Thank you.
Great. I don't really, we have so many questions, Dr. Olajuwon, so many questions. I don't know whether we should take some questions and then continue. Should we take some questions? Yeah. What do you think?
I mean, there's some questions.
Yeah. Okay. What about diet? Does it affect the growth of the fibroid? That's one question. Does the diet affect the growth of the fibroid?
Yeah. I mean, remember when I started, I think, okay, so fibroid is hormone dependent.
Yeah. Meaning
that it's sensitive to particularly a hormone called estrogen. So there are some food that are very rich in estrogen. And let me just see whether anybody in the audience can, if I say, just give me an example of a food that's rich in estrogen. Let me just see whether, 1 second to see whether somebody will get it. In Nigeria, in estrogen.
So, folks, let's know if you...
Let's see whether, I'll just wait for 1 second, and then if they don't say it, I'll say it. And I'll make some reference to a particular... So nobody says,
yeah.
She got it, yes. Is it Bellium stitches? Bellium stitches.
Bellium stitches.
The first word, Bellium stitches.
Okay. So, what about, someone put red meat?
Okay, we'll come to red meat as well. So let's start with yam.
Okay.
So the first thing is that everybody knows Nigeria for one thing. Nigeria, if you go to an international event or a meeting of obstetrician, they will talk about twinning in Nigeria.
Yeah.
And then they will talk about a place in southwest Nigeria called Ibora.
Yes.
Known for is almost every family have a twin in that town. So it's almost, and their staple food is yam.
Okay. Oh, he's frozen.
So, can you hear me?
Yes, it's come back.
Okay, yam has an estrogenic effect. So that can also be extrapolated to fibroid as well, because fibroid, yam can give you a lot of estrogen, and then it makes you so. But it's not only yam. You have red meat. You have I think there's a list somewhere, but the one that is common to us is carbohydrates. So things like gari, cassava, yam, and red.
What are we going to eat again? Because those are the things we eat all the time.
But you can just eat it in moderation, rather than, you know, unfortunately in Nigeria, our meal. Sorry.
It's okay, your dog. Don't worry.
So our meal, unlike most places of the world where sorry, let me just see whether I can settle him. Okay. So Ralph.
He's tired. Is it as a guy, as a boy, or whatever?
Sorry, just give me 1 second, please. 1 second.
Okay. While Dr. Juwon is away, I am not an obstetrician and I'm not a gynecologist, so I can't talk about some of those things. But I'm not sure what question it is that is answered before I came on. But I think one of the things you'll be looking at is what is fibroids, and I think he's done a good way of trying to present it with the diagram.
Yeah,
who gets fibroids?
that was the first thing he answered actually.
Yeah.
What is
Who,
fibroid?
who gets fibroids? When do they get fibroids? Why? Which is what we're talking about, males, and how can it be dealt with? And just on a separate issue aside, as to we're talking about women, and the question is, can you also define women? Or who is a woman and what is a woman?
Please don't go there. Don't go there.
Go there.
Okay, sorry, you're back, so you can go on now.
Don't go there, please, Dr. Saka. What's the name of your dog?
His name is Ralph.
Browse.
Hello. Yeah, Ralph.
Ralph. Oh,
Ralph.
Okay. It's so cute.
Okay.
Dr. Saka.
I was talking about the food. Yeah. So yam, red meat. So I think like most people say, in England, when you go to a restaurant, you want to, so your meal is the protein, which is I want meat,
Yeah.
and then a bit of rice. But in Nigeria, you know, the way we eat the rice. So like I'm saying, it's not that you have to stop eating these things, but just in moderation.
Okay.
So I think if you reduce it, and I've seen people do like, so they go on the internet, they read a lot about estrogenized food, and they start a diet. It doesn't necessarily reduce, it doesn't necessarily make the fiber disappear, but it reduces the size or the growth of it.
Okay.
So definitely, I totally believe that diet contributes.
Diet does contribute. Okay.
Yeah.
Do I have to take out my womb for treatment of fibroid? I don't think so. No, I don't think so.
So one of the disparity between the UK system and the Nigerian system as well is that for you to go for a fibroid surgery in the UK, you have to sign a consent that says that there's a 1 in 4 chance of them removing your womb.
Okay.
Because of, if we get there and it's complicated to remove the fibroid, we might remove your womb. So that's one. Now, one of the things about, a few years ago, a friend of mine sent me a picture of another friend where they removed her womb in the States.
Okay. And
the indication was fibroid. And I looked at the picture, and the fibroid was so small. And I'm thinking, why would you do that?
Wow.
I think so our peculiarities are totally different. The way that we look at things in America or England, a typical white doctor might decide that I don't need a child, I'll adopt a dog or a cat. Yeah. So unlike here, that in Nigeria, I think having a child is almost, if you don't have a child, obviously it has cultural issues and stuff like that. Yeah. So a lot of people would rather not lose their womb here. I can also say that I've been doing fibroid surgery for a long time. I've not needed to remove somebody's womb once.
Oh wow, that's good.
Unless they've completed their family, obviously.
Yeah.
Completed their family, you give them the choice, and they decide that, you know what, I'd rather not deal with this again. All right.
Yeah.
Now, but I'll tell you something interesting. It's amazing that some people in Nigeria, even after completing their family, would rather you don't remove their womb because they're thinking about afterlife.
Oh, okay. Really?
Yeah.
Wow. Okay. Please.
So we get all, but it's their choice and it's their belief, and you respect it.
I guess so.
Yeah.
I don't understand it, but I guess it's their belief, like you said.
Absolutely, it's their belief. I think in as much means that you need to let the person understand all the risks. But they're adults and they can make their decisions as long as you don't think that is a dangerous decision. If you think it's a dangerous decision, then it's different. But if you think it's not, then you have to respect it.
True. Okay. Oh, Please again, folks, if you've got questions, put them in the question box. That way I can pick it up easily.
I can see a question now, if you permit me to answer it. It says, has embolization of fibroid been perfected?
Yes, go.
So, like I said before, I think embolization of fibroid 25 years ago is definitely different from this, the one they do now. So about a few years ago, so basically what you do is that you get some particles, some digestible particles, and then you put it in the blood vessel and they go and block the tiny blood vessel. And over time, your body dissolves it. But before it dissolves it, it's killed the fibroid. So the perfection might be that they are better at identifying the blood vessels to the fibroid, or they've also perfected or find a way to make the particles a lot smaller and also better quality. So that's the only thing they perfected there.
Okay.
The problem for me is that, I mean, a few years ago as well, there used to be, so when we want to send somebody for embolization, you have to tell them that there's a 1% chance of making them menopausal. So just in case those particles go and block the blood supply to the ovary.
Yes.
But that is also because the skill has been upgraded over the last few years. So that doesn't usually happen again, but you still have to mention it to somebody. So maybe that's where the perfections are.
Okay. Okay.
I think over time the embolization will get better as well, because going into a different aspect with oncology, we're using a lot more embolization, and that's because we're able to map the blood vessels. So we're getting better at mapping out the blood vessels, identifying the blood vessels that we need essentially. But obviously, we're doing a lot more with respect to cancer rather than with fibroids. So a lot of the funding and research will go towards cancer, and we can then extrapolate it later on towards things like fibroids. So yes, with time, we'll get better at it. But the real question is it the right thing to be doing if there are other options, such as medical treatment and then surgical treatment?
Yeah. I think the main thing is for you to be able to offer all this option to a woman and let her make an informed decision, a very informed.
Yeah.
So the problem we have is that our advice to people are biased. For example, if I'm a surgeon, I'm most likely going to advise you that surgery is better.
Yeah.
If I do embolization, if it's private practice, I might want to push you towards embolization as it's the better one. So what I usually do is I write all this option down and I tell people to go and do their own research as well and come back, and then we can agree on the way forward.
Yeah.
So I think that it allows them to ask all the questions they want as well, you know.
I like what you said about people being biased. Just true.
Yeah.
That's why everyone should do their research.
Yeah.
Properly. Okay. Is it true? How true is this statement? Fibroid is present in every woman until they start to grow and cause pain. Is that true? The fibroid is present in every woman.
What did you say?
Is it true that fibroid is present in every woman?
No, that is not true. But the prevalence is very high in Black women, okay, especially the reproductive age group, sometime between 50 to 70%.
Okay.
Yeah, but it's not in everybody.
Okay. All right. Someone sent in there. She said she went for a scan and she was showing the result, but I'm not going to go through that. You can send Dr. Olajuwon a DM later on, but we can't go through your medical reports online. I'm sorry. What is the cause of infection after fibroid surgery?
So the cause of any infection after a surgery is, right, remember that the body is extremely sterile. The inside of the body is extremely sterile. And what you tend to do is you tend to use sterilized, so you want to, can you hear me?
Yes, it's breaking up a bit, but I can hear you.
No, I'm in Nigeria, so, right.
Okay, I think
I think
it's
it's
gone
done
off a
it
bit.
again. Maybe I should change it to my wife. But just give me a second. Let me see whether I can. Hello, can you hear me?
Yes, can hear you.
Can you hear me? Okay.
Yes.
So, can you hear me?
Yes, I can hear you.
So, what was the question again? Infection with
Yes.
surgery.
Yeah.
Yeah. So, infection in surgery, no surgical field is 100% clean of infection, whether you're in Nigeria, whether you're out. And a lot of hospitals are doing a lot of research. I think now there is a process where in theater, they've started doing something called negative pressure, where they suck all the infection and air out of theater to make almost like 100% sterile field.
Right.
But that I have to scrub myself, I have to put gloves on. The assumption that I'm 100% sterile is, as long as you're going inside somebody, there's a risk of infection.
Sure.
And also there's also research going on how to sterilize equipment so that it's 100% free of bugs. So I think those are the cause of infection, really. So now it's normal practice to give people antibiotics immediately after surgery, just to reduce the chance of infection.
Right. Okay. All right. Thank you very much. Well, let's see. Is surgery expensive? That's a question.
Well, expensive. Let me give you a story. So early last year, was it early last year or this year? Early last year, I saw a patient in my hospital in Lagos.
Yes.
And she wanted to have a surgery, and so we would have done something. So I'll use it to answer somebody's question as well. We're asking us whether we do minimally invasive surgery. So yes, I was going to do something called laparoscopic surgery, which is minimally invasive surgery on her. So I think she decided that, doctor, thank you very much, but I'll go to the States to do my surgery. So she traveled to the States. And then when she got to the States, there's a new technique called robotic surgery. Oh, yes, I would like to have that. So robotic surgery is a newer version of laparoscopy. It's almost like laparoscopy, but it's a newer version.
Yes.
And so they gave her a bill. Guess what the bill was?
$10,000.
$100,000.
Whoa.
But
wow.
she negotiated it and she paid about $40,000.
Okay.
Now, so in my hospital,
yes,
the surgery is equivalent to about 2,000 pounds.
wow.
In the UK, surgery is about 8,000 pounds.
Wow. That's quite reasonable.
Yeah. So you can imagine how a lot of UK people would jump on the plane, buy a ticket for 1,000, come and spend 2,000 pounds in Nigeria and then go back. I think, to be honest, I was thinking about this morning that how come we haven't started talking about this medical tourism? Because it's happening.
It's happening, yeah. I guess it's the same way people from here, they're going to Turkey and all of these countries.
People are coming for fibroid and IVF.
Yeah.
A lot of people are coming to Nigeria for it.
I did hear about IVF. I heard that people are going to Nigeria for IVF.
Yeah.
I didn't know about the fibroid one. So that's
the fibroid is actually the fibroid in the last, like I said, in the last 6 months, I've treated a lot of people from Canada and the UK. I think I have somebody in my hospital at the moment from Manchester.
Oh, wow.
So I think it's not all doom and gloom in Nigeria as people think, and it's safe, it's safe.
Okay.
So please don't always bash the Nigerian doctors.
No, I think it's
Nigerian hospitals, Nigerian sometimes we do things rightly.
I guess you hear more of the bad stories. That's the
Well,
truth.
Well, unfortunately, bad stories fly. Like I said, I think things are not. I mean, let me give you an example, and I'm sorry to say this. I do not want to disrespect anybody in any way.
Yeah.
I was looking after a patient about 2 years ago, during the COVID season, and she was meant to have a baby in our hospital. She went through an IVF, got pregnant. First, she was 40 something. She got pregnant, and when she got to about 32 weeks, despite all the COVID restriction, she was adamant she was going to go to the US. So, for me, it's your choice. But right now, I wish I had told her not to go.
Okay.
Anyway, she went, she had an elective cesarean section in the United States, and then died on the table.
Wow. Okay.
Now, the problem with that is that nobody hears that.
No.
But just extrapolate it to happening in Nigeria. You can imagine how, think about how this will vibrate all over.
Yeah.
Or the Nigerian hospitals, they've done it again.
Yeah.
They've killed this person,
Yeah.
they've killed us.
Yeah.
So I think there will always be mortality and morbidity in surgeries.
Yes.
The only thing is that you have, whether it's the UK, I mean, let me give you another example, and this is right in front of the UK. You guys are UK.
Yeah.
About 5 years ago, a UK doctor took a girl to a theater and then used an equipment that he's never used before, an 8-year-old girl, and the girl died on the table. So I'm not saying, I'm just saying that you will not hear all of it because there's so many. So the assumption that the UK system is safe is there.
Yeah.
So things do not come into this. But once it happens in Nigeria, everybody hears it. Just one mortality, everybody hears it. And then it becomes a big deal.
I guess the other difference here is that for example, that doctor that you talked about who probably used an equipment he had never used before.
Yeah.
He'll be investigated. He might be struck off and all that. But in Nigeria, you don't get that.
Yeah. So I think the regulation is coming. I won't say that you won't get that. It's happening.
Okay.
But not at the. I mean, for example, so look at Lagos State. Lagos State has a regulatory body called a farmer.
Yeah.
Those are so. If a patient reports you to a farmer, they will come and start investigation in your hospital. Sometimes suspend your facility until they know that whether you're right or wrong. And please do not be. A lot of patients are suing hospital in Lagos now, at least in Nigeria.
Yes.
So it's getting there. I think now, unfortunately as well, I totally agree. Accountability is a big issue. And also, for example, in my facility, I mean, obviously because I have a UK background, we have the process of something called clinical governance.
Yeah.
Where, I mean, Dr. Saka will know a lot about clinical governance, where those are the pillars of good health services. One, you have to encourage your patients to complain, and you have to know that when they complain, you have to let them know that you take it serious. Right. And then that complaint, you have to use it to look at your system and adjust your system the way it should be.
Yes.
Two, you have to audit your processes and your outcomes as well.
Okay.
So what are we doing wrongly? What are we doing well? What should we continue? What should we dispose of? Your doctors and nurses must go for regular training. Stuff like that. So yeah, but it's getting there. In Nigeria, it's getting there. It's not there. Yeah. A lot of it is driven by the vision of the person that's running the hospital.
Yeah.
But a lot of the facility, I mean, for example, people have started doing, I mean, Benga will also know about CQC.
Okay.
So in Nigeria as well,
CQC means Care Quality Commission. Okay.
Yeah, so now Nigerian hospitals, because there's no government agency doing that, we are outsourcing that, either associating it to South Africa, going to something called COSASA. We have recently done something called Safe Care. So it's all about asking people to come into your facility and assess you.
That's
So I think
very good.
once you start doing a lot of that, things will start changing.
That is very good. That's quite commendable.
And
That's really good.
I think one of the other things is that we're still hoping that we will drag Dr. Saka back to Nigeria. But there are a lot of people like me that came back from England and America, and they're doing good things. I mean, recently they've started doing minimally invasive brain surgery
In Nigeria. Wow. Wow.
Yeah, like
That's
I said,
good.
they started doing minimally
It's good to
invasive
hear.
brain surgery.
Dr. Joe, I'm so glad to hear all of this because we don't hear this. We don't hear about this. It's all the bad news. Nigerian doctors, you have to be careful. Even the best doctor, you keep hearing all these things. But it's good to hear all of this from you.
I mean, to be honest, I think there's a lot that needs to be done about the training of the Nigerian doctors. Yeah. But remember, I think what I always tell people is that don't take medical profession in isolation. Okay, so you have to look at the roads.
Yeah.
You have to look at the education. Yeah. You have to look at NEPA. You have to look at everything. Yeah. So it's not only, so if you want a fantastic doctor, you have to invest in this university.
Okay.
So you can't say,
okay, I'm just saying,
Dr. John saying, of, and stuff like that. So it's totally different. So I think there's a lot to be done, but we're getting there.
Okay. More questions for you. And what are the chances of regrowth after a surgery?
Okay. So
sorry, before you answer that, let me just someone just asked for your handle, and you should go through South Shore, Lagos. I think that's the handle to go through. South Shore, Lagos. Yes.
At South Shore, Lagos.
At South Shore, Lagos. Yes. So what are the chances of regrowth?
Okay. So the overall chances of regrowth is about 30% in 4 years.
30% in 4 years.
But I isolate it as well. I isolate it. For example, if I see you and you only have one fibroid,
yeah,
and then I remove that fibroid, I can almost say that the chances of regrowth is 0.
Oh, okay.
All right.
Yeah.
If you are like 30 and I remove one fibroid, the chances are. But if you're 30 and I remove like 50, the chances of regrowth is almost 100%.
Okay.
So it depends on your type of fibroid and it depends on a few things. But overall, the chance is about 30%. 3 in 10.
Okay.
In about 4 years.
In about 4 years. Okay. For someone who has not given birth for once and intend to do so, do you advise fibroid surgery for her? Again, I guess it depends.
It depends, yeah. So some people, you don't have a choice. You have to remove it.
Okay.
Some people, I might advise you that, okay, why don't you try for a couple of months and see what happens.
Okay.
As long as I know that it will not cause you a miscarriage. Some people, you will tell them that you don't need surgery, just go and try to conceive or come back in a year's time. And in some people, you will say, you know what, madam, you cannot get pregnant without this surgery. Or even if you get pregnant, you may lose the pregnancy based on this fibroids you have. So I think the main thing also is to be honest with people and also don't mince your words as well. I think a lot of people that see you in clinic are probably seeing like 3 other people before they see you.
Yeah.
So they have different opinions.
Okay. Wow. There's so many questions about fibroid, but I think if you want to find out more, people should reach out to at South Shore, Lagos, and you can speak to either Dr. Olajuwon or one of the other doctors, or they'll put you in touch anyway with them. Because I want us to talk, in the time that we have, I want us to talk about this other thing that a lot of women are asking about, which is freezing their eggs, especially as they get older. So, Dr. Olajuwon, what's your take on this? I know it's something that you guys do, but so if a woman's getting older and she's not married, what would you say to her?
I'll say freeze your eggs.
Okay.
I think so. You know, because I come across a lot of women who are in their early 40s, like maybe 41, 42.
Yeah.
And unfortunately, they're not in a relationship. And when they enter a relationship as well, I am very saddened to be telling them that, Madam, I don't think your ex will work anymore. So I wish that I had met them about maybe 10 years earlier.
So what age what's the best time or best age, shall I say, that you should consider?
I don't think there's an age to it, but I think that maybe when you're like 33, 32, 33,
okay, and
you're getting close to the late 30s, then go and freeze it.
Okay.
When you're in your 20s, I don't think anybody will freeze their egg unless it's a cancer-related one.
I was going to say,
if it's a medically indicated or a, medically indicated one, then it's a lot younger. But for a social one, I just want to keep it. A lot of people are still hopeful that they will meet a young man or they will meet a man and stuff like that. But when you start getting to your 30s or early 30s, where you're still very fertile, you still have a lot of eggs, I will advise you to to go and store it at that time. But you can store your egg even till the 40s, though. I think it's just that the quantity that you will get towards the 40s or early 40s is not as much as when you're in your early 30s.
Okay. Is the process difficult? What does the process?
No, the process is almost as if you're having IVF, but without So let me break it down.
Okay.
I'll talk about IVF. So IVF means that I want to get you pregnant. And I don't want your body to take control. I want to take control of your fertility.
Yeah.
So the first thing is to stop your ovaries from producing eggs. You know, your ovary can only produce one egg a month, but I need more than 1 month. I need more than one.
Yeah.
So the first part of it is to control your ovary, stop it from working. So I take control of it with some tablets or injection, and then bring some fertility drug to stimulate you so that you produce more eggs. So those are the injections with, when you say, I've been on injection because I want to do IVF.
Yes.
So those are the injections. And then a couple of, 2 weeks later, the eggs are big enough to be matured.
Okay.
And then you go and harvest them. So that's the difficult part. It's almost like, it's a very small procedure where we take a needle. Yeah. We give you some anesthesia, and we take a needle that goes with a scan. We can identify your ovary and then use the needle to suck the egg from there and obviously transport it to the lab.
Okay.
So that's it. That's the process, really.
So,
and then
just trying to think.
The lab now freezes it.
Okay.
How long can it be frozen for?
What I was going to say.
Well, there was a case, I don't know, was it in England or in America? So there was this egg that was frozen from 1976.
Wow. And
they just used it the baby was born last year. So
1976.
So how old is that child?
Wow. Yeah, good question. How old is that child? My goodness. Wow.
Yeah, so that just answers.
But presumably it wasn't the mother that got the egg from.
No, it wasn't the mother.
Okay.
They put it out. So see, those are there are a lot of ethical issues with IVF and stuff like that.
Yeah.
So if you don't freeze your eggs now, you will get to a point where somebody's advising you that you need donated eggs. So I think it's important to start thinking about freezing your eggs so that in case you get to the 40s, you don't want to find the person and then you're using borrowed eggs. So that's
talking about age, and we're saying usually the older they are, the less likely. Does it mean that if somebody is still having regular periods in their late 40s, you won't be able to harvest enough eggs? Or does the regularity of the periods mean that you still be able to get eggs irrespective of the age? Or it's just that the eggs are completely used up?
No, so when you are when you are in puberty, you have about 3 million eggs. So, but every time you have a period, you're losing thousands. So by the time you're getting to your close to 40, you don't have as much because you've lost. So to produce one, you lose about thousands.
Okay.
So by the time you get to your 40s, period is irrespective. You can have regular period, but no eggs. All right. So the period doesn't determine whether you have eggs or not, especially in your 40s. So there's a test we do. We run a test called AMH, which is anti-Mullerian hormone. And it allows us to know the ovarian reserve. For example, if a 40-year-old comes to me, it's likely that the ovarian reserve will be low, but I want to see whether there's even any chance of getting some eggs.
Okay.
All right. But most importantly, the only way that you can know that somebody doesn't have eggs is by stimulating them. So if somebody comes to me at 43 and say, doctor, I want you to see whether I have eggs, I can still try to stimulate them, but they need to know that they might not get any eggs.
Okay.
Some people are happy to get 2 eggs, but what is the point of that? Because when you freeze 2 eggs, the chance of getting one back is almost 0. Because the freezing process, you lose some eggs.
Right.
When you freeze them and when you're unfreezing it, when you're unfreezing it, you lose some.
Oh, okay.
So that's why it's also important to freeze it when you have a lot.
Yeah.
Yeah.
So the more eggs you freeze, the chances.
Yeah.
Oh, okay.
So what some people do with that is that when they're close to their 40 or just early 40s, they go through that process a few times.
Okay.
So for example, they might go one cycle now, you get 4 eggs.
Yes.
They'll rest their body and then go another one in a couple of months, get 4 eggs. So total, they might end up having 12.
Okay.
Yeah.
Right. Just saying, there's a question. Can you have no period and still have eggs?
Can you have no period? Yes, you can. Yes.
Okay.
So it depends on. So there's so many reasons why you can have no period. For example, there's some people that have period, but it's the passage for the period to come out is blocked. So they're having period internally, but it's not coming out. So they're saying, I don't have periods. But it's just collecting. So, there's something called Asherman syndrome, which is intrauterine. So there's scar tissue inside the womb, which can happen after evacuation or fibroid surgery. So in situation like that, yes. But if your womb is perfect and your ovary is fine, then you should have a period.
Okay. You
should have a period. But if you're having no periods, the first thing is for me to check and see whether you're menopausal or not.
Okay.
There's another question there that I can see. Starting period early, does that mean you get to menopause early?
Yes.
So is it early period, early menopause, or late period, late menopause, or how does it work?
Starting period early means early menopause, yes.
Okay.
But remember that most people will start period about age maybe 13. Some people are starting at 10, depending on their body. So the age is relative. I mean, menopause is usually maybe 52, 53 average. So when you mean early might be they start at 49, become menopause at 49 or 50. Some people become menopausal at about 56. So everybody is different.
Okay. Any other question about
somebody said, can someone who has done fibroid surgery twice still get pregnant? Absolutely. They can still get pregnant. Now, it depends on so for example, if you've done fibroid once and you want to do another one, you want to know that the tubes are, so you can get, so the easy way to answer that question is yes, IVF will get you pregnant. But if you want to get pregnant naturally, the person that's doing your surgery must have ensured that they try to protect your tubes, your fallopian tubes. Now they can try, but it depends on how your body also responds, because people can try to prevent adhesions from forming by using anti-adhesions, but your body can still decide that, right, this is what I'm doing. So the answer is yes, but it's more technical than that. If it's natural, you might need help. That's what I'll say.
Okay.
There's one other question here that requires expertise. Basically, somebody with PCOS, polycystic ovarian syndrome, and their period is not regular, can they still have adequate eggs to be harvested and preserved?
Yeah. So PCOS is actually a very unique condition. So when you
and so please tell us what PCOS is. I'm not sure that many of us know what it is.
So PCOS means polycystic ovarian syndrome. Polycystic ovarian. It's a hormonal. The way to make it a bit lay is to say hormonal imbalance. So your body is producing a lot more of the hormones that are commoner in the male compared to the female one. So it actually confuses your body. So you still ovulate, but not ovulate as regularly as you should. So sometimes they don't have a period for 3 months, 4 months. But in terms of eggs, they actually have a lot more because they have a lot of immature eggs. So when you try to stimulate them during IVF or any condition, they have a risk of having something called hyperstimulation. They have more eggs around. So in terms of eggs, you have eggs. It's just that your body is not, mechanism in your body is not letting you produce eggs every month. That's the easy way to describe polycystic ovary.
Okay. There's a question. So can fibroids turn cancerous?
Very, very interesting question. That's it. You know when they say that's a jam question or whatever. I don't know whether anybody did jam. There's some question in jam that you don't know. Okay, so let me. So the question is no.
Okay.
Or the answer is no.
The answer is no.
But there's a but.
What's the but?
So Dr. Saka knows that there's a condition called leiomyosarcoma, which is a long distance relative of fibroid.
Okay.
And present identical to a fibroid, looks like a fibroid, but it's cancerous.
Okay.
So I like telling stories. Let me tell you another story. So about 8 years ago, a doctor in America who works in a hospital approached her friend and said, "Oh, doctor, let's say Dr. M. Oh, I wanted to come and see you in the clinic. Actually, I have a fibroid. Do you mind removing it?" Dr. M, who is the friend, said, "Oh, why not? Happy to remove it. Come and see me." Had a scan, took the female colleague to surgery and did a laparoscopy.
Yes.
So remove the fibroid. With laparoscopy, to remove the fibroid, you got to cut it into pieces with an equipment called musculator. So remove the fibroid, send it to the lab for them to do studies on it. The lab doctor, the pathologist, called the doctor immediately. "Hey, guess what? The fibroid removed is cancerous."
Wow.
Cancerous? Oh, wow. A year later, the woman died.
Okay.
So the problem is that sometimes some fibroids are cancerous. Whether they turn into cancer or they're totally not off. Can you hear me?
Okay, so while it's freezing, yeah.
Yes.
What we know is that majority of fibroids are not cancerous.
Okay.
But in the last 5 years, I have seen women in their 40s who have that condition I mentioned.
Yes.
Which are cancerous looking fibroid. So that's why I said it's a jam question. You can see, I mean, even you kind of side that.
Yes.
Okay.
Okay, because I'm thinking, does that mean you should be worried or should one be worried?
I think if you are in your 40s and you have a fibroid, I think you should be careful how to manage it.
Okay.
You should, if your fibroid is becoming painful in your 40s,
yeah,
and also it's getting your fibroid is growing very rapidly, you have to go and remove it, remove the womb, remove anything, so that you don't have a story. So unfortunately, we do not have a way to diagnose that condition before surgery. So if we have a way, then it's easier, but there's no other way. You can do MRI. MRI has some features that allow you to think, oh, this may be, but it's not confirmatory.
Right. Okay.
Yeah.
I guess the take-home message there is that if you're going to have a fibroid operation, have it in a reputable hospital, because every tissue that's taken out of somebody is supposed to be subjected to histological examination. It doesn't matter when it's done, how old you are.
Yep.
And that's what picks up the difference between something that is benign that's never going to be cancerous or something that may well be cancerous. So it's the aftercare. And what tends to happen a lot of times, people just go have their fibroid surgery done, and that is it. So there's no aftercare. There's no follow-up to say the tissue that was taken out of you is truly a fibroid and it's nothing to worry about.
Benga, did you say London or Nigeria?
I didn't say anywhere. I just anywhere. I just said anywhere that you have.
Okay. Well, the typical case in Nigeria is that sometimes when you bill somebody for histology, which is this to test, they ask you, doctor, do you have to do that?
And that's why I use the word. That's why I use the word reputable hospital. So if it's a
if you don't
reputable
want me to do
hospital,
that, don't do the surgery here.
Yeah.
What maybe what you should do then, maybe what the doctor should do is kind of make that part of the package.
Yeah. That's what we do. But you still have to break it down. It's a total package, but you have to. So you have to itemize your cost.
Okay.
So when you itemize, it's a package, but you just show why you're charging that. So you can't come to my hospital and have a surgery and we remove something and we don't send it off. It's not possible.
Okay.
Because like Dr. Saka said, but remember that we still have different cadres of hospital in Nigeria, and that's the difference between your place and our place.
Yeah.
A doctor can finish medical school today and decide that they want to go and start a hospital, having not going through a proper specialist training. A lot of specialists in Nigeria will know the reason why they need a histology, but not everybody does that. So I think until we secure our regulatory bodies and make sure that things are tightened, then we will be having it.
Just a separate story there. One of the commonest operations that people do is to have their appendix taken out. And for a lot of times, you just assume that just appendicitis and you have it taken out. Occasionally, in some of those specimens, there's evidence of cancer. So even here in the UK, when appendixes are taken out, it's still subjected to histology review. Sometimes what happens, however, because we have not suspected cancer in the first instance, it may take us about 2 months later before we actually review the specimen and say, that specimen that you removed 2 months ago has cancer in it. So we then have to bring the patient back. So anytime any tissue is taken out of anybody, it should be subjected to histology review.
Okay. Wow. This has been so insightful. And I know we could go on because there's still questions popping up, but we have to go. Dr. Alabi, maybe we'll have to bring you back again sometime. Because I know there are different areas that you deal with, and I know women will always have questions anyway. I mean, I saw a question about HRT, so please, would you come back again?
Would I come? Oh, absolutely, I'll come back again. So I also just want to put it in there, and I think I sincerely hope that at some point you will want to create some awareness on a condition called endometriosis. Endometriosis is a very common condition which causes a lot of pain in people. Some people, and it's also, we notice that a lot of people that have fibroid also have endometriosis. And unfortunately, they think that they have pain and they think that by removing the fibroid alone will reduce the pain. Meanwhile, somebody has not told them they have endometriosis. So I think you should also maybe find time for us to talk about endometriosis, which is, I think if you're based in the UK, you probably would have heard about it. If you go to your GP and say, I have pain, they're probably going to say, oh, let's make sure it's not endometriosis. But if you happen to have some Nigerian followers as well, then it might be some enlightenment in that aspect might help as well. Yeah.
Okay, we'll definitely have you back to talk about that. So thank you again, Dr. Alabi. Truly appreciate your time. Thank you for educating us, even me. And if people want, you have further questions for Dr. Alabi, you're considering having your surgery in Nigeria, please reach out to at South Shore Lagos. That's their handle, at South Shore Lagos, and someone will definitely get in touch with you. And can we just appreciate Dr. Alabi? This has been so good, really good. It's the kind of information that you pay for. So thank you so much, Dr. Alabi. And again, a shout out to our Dr. Saka for recommending him. Absolutely superb. Thank you, both of you. We really do appreciate you. And before we finish, again, please follow us on YouTube. The handle is Oluwadeaga-Hangout the Cafe. And if you want to join our retreat, it's in September 15th to 17th. It's a residential retreat for the weekend. And lastly, we've got the Hangout Cafe Book Club. The book we're reading this season is Make Today Count by John Maxwell. If you want to find out any more about these things, please send me a DM. And thank you to everyone. Thank you for being so engaging. All of the followers, those that have joined from Lagos, London. Thank you for being so engaging. I personally love and appreciate you all. But thank you again, Dr. Alabi. See you soon.
Thank you very much. And thank you for having me.
Thank you for coming on. Oh, sorry. One more thing before we go. Hangout Cafe is closed for June. We're taking a well-deserved break. So we'll be back in July. Thank you. See you soon.
Bye-bye.
Bye-bye.